good evening. Welcome back to another episode of Let's Talk About Mental Health. I'm Nels Kloster. I'm an addiction psychiatrist working in Southern Vermont.
And my name is Robert Stack, and I'm a licensed alcohol and drug counselor, a licensed mental health counselor. And again, I want to thank everybody for the folks who have been watching us and the comments that we get. And I want to mention that if you have any comments or questions that you'd like to share with us, we have different ways that you can do it. So the first one is let's talk about mental health at gmail.com, or you can text us at 802-490-3590.
And we also have a Facebook page, so you can get us there from Facebook at Let's Talk VT. And it is case sensitive, so capitalize the L and the T and the VT.
So thank you all very much. And last week we started the discussion talking about relationships, and one of the ways that relationships are, I think you mentioned it, that relationships are probably the most important part of recovery. Is to have one, and the importance of love in our lives. And so I wanted to follow up a little bit more about some of the things that we talked about, and then perhaps as the show goes on, we'll move into talking a little bit about the holidays.
Because I mean, we're social animals. We're not meant to be alone. And whenever you look at quality of life, and that is what recovery is about, relationships are a big piece of that.
Thank you. And earlier today, we went and did a talk up in White River Junction, helping some coaches in recovery who are working with people with opiate addiction, and we really tried to make that point that that you can take medication so that you're not in withdrawal and you're not suffering from chasing the drug, but that should not be confused with recovery. It's a good beginning in recovery, but it's really recovery is so much more. And I got to say, one of them is perhaps mending the fences from the past, but probably even more enjoyable and more important is developing new traditions in sobriety, new relationships in sobriety with new folks. So, but if I could just step back for a moment, I just want to mention that I talked about how children are sometimes affected in alcoholic families. And years ago they did a study, and one woman came out and she gave different roles to different members of the family. And it's interesting that she sort of worked, I think, in a urban area where they had 6 kids, so that she was able to get.
So there were enough roles to go around for everybody.
Roles to go around. But and some of you, depending upon your generation, they used to talk about the family hero, and that would be the child that would be the most successful, and he would be responsible for there's nothing wrong with this family. Look how good we are. Look how we're
the public face for the family,
public face
right?
of the family, and a lot of pressure on that type of person. Some people would say almost like Bill Clinton, very dysfunctional family, alcoholism, a lot of domestic violence, abuse. And yet there he was, like holding the standard.
I was thinking about Jimmy Carter and his brother Billy.
There you go.
Going back a ways.
Go back there. So you just see it. And I mentioned last week that every child's unique, and their relationship with their parents is unique. But one of the things they used to talk about, and this happens a lot, is that you'll see one of the children in the family will sometimes try and make things right. And this was the one that would go back and forth with messages between the different parents. This is the one that would be sort of like their most fervent hope was that everybody could be happy.
Well, like daughters in alcoholic families tend to strive for perfection. Their middle children are often sort of peacemakers, because they're just trying to kind of keep this together. And it's like a dance, right? And often this is what people struggle with in early recovery, is their families aren't necessarily coming along in recovery with them. It's a rather individual effort. And they can't understand why their family doesn't encourage them, why they don't support them, why they continue to do the things they've been doing. And the way I've often portrayed this is it's like a play or like a drama. And if you can imagine, whether it works well or not, whether we call it functional or dysfunctional, everybody's playing a role, and it has worked well enough. And is sort of, limped along possibly, and then all of a sudden you're saying, I don't want to play my role anymore. So imagine on a stage production, I'll say, I'm not going to be the scapegoat anymore. I'm not going to be the peacemaker or the hero. And then you leave everybody else in the family to play their same roles, and it doesn't work.
Right.
So there's this, sort of unconscious effort to bring you back in to play your role. Please don't change this for us. We don't want this drama to change. We've been living with this long enough. We don't want you to mess it up for us.
And it's interesting you mention that, and especially I talked about, they sometimes will say that there's also like the scapegoat that you just mentioned. He's to blame. He's the problem. And a lot of times you'll find out that that's the one that gets involved with drugs and alcohol. And it's kind of interesting to know, and in the years that I've noticed this, a lot of times the hero will leave home, will go someplace else. But the scapegoat, the one that's the problem, they don't go away. Like they stay. They're the loyal ones, actually.
It's like living down to expectations.
Well,
almost,
I don't know, but and I mention that only, and I don't really want to make this program all about that. But I mean, the idea being that if you're living in a dysfunctional family, if there's alcoholism and drug addiction in the family, and you're growing up in it, you learn to cope with that situation, and you learn the best you can. And different people adapt different ways to it. And I guess the problem was because I didn't work with adolescents, but I worked with adults who sort of identify with these roles. They sort of carried it into their life. Right. They carried it into their life, and they found that they weren't themselves. I mean, I don't know how to explain that too much, but you would almost see that some of the stuff that they adapted in childhood, they were now still playing out that role in adult life. Yeah. And I guess I have to acknowledge this. If they're talking to me in a hospital, that usually means it didn't work for them. For some reason. Sure. And maybe it worked for others, but for them, it didn't work. Yeah. So I guess I just want to finish up with this thing about relationships a little bit, is that if you grew up in an alcoholic home, if you grew up in a family that had severe dysfunction, I imagine it affected you. I imagine that, you coped, you probably did well with it, or maybe you didn't, and you learned to live with it. And what you would now as an adult, you want to have, you'd want to develop insight. You want to be able to look at yourself and say, I've done this all my life. And like you were saying, I'm not going to play this role anymore. Yeah. I'm not going to do this role anymore. Yeah. Now, there's nothing wrong with being the hero. There's nothing wrong with being successful or being on the honor roll. But it's not about doing it to cover up something. Yeah. You know what I mean? You want to do it because it's what you want to do. It has to be. And if you want to be a caretaker and you want to get into the business of helping others, fine. That's a beautiful thing to do. But don't think that the only way you matter is that if you're helping someone else.
Right. Because we sort of struggle with the ideas that we're not good enough, right? One of the bases for a lot of therapies is that we need to overcome that, because our thoughts and emotions really get driven by this idea that I'm not good enough, and I need to play a certain role if I'm going to be worthy of love, of attention, of praise.
And that's part of it. You'll find that sometimes that they really feel they have to earn it, or or that they're unworthy of it, and you run into that, and obviously. So I guess if you're an adult and you're listening to this now, and you grew up in an alcoholic home, I would imagine you did not escape unscathed.
Right.
Nor do I assume that your life is a mess or a ruin or anything. Yeah. I imagine that you learned, you coped, you survived whatever way you can. The only thing now, I think, would be to be able to recognize it. Yeah. To see.
Because we do. I mean, if we talk about alcoholism, drug use, all of this can be devastating to a child, but at the least, there's a withdrawal, there's a lack of intimacy, there's this sense of being alone, and then in the worst cases too, then there's violence, there's maltreatment, in which case you become very good at reading signals and judging human nature, but then too sort of being apart and being defensive. So again, that's a stance that really is counter to developing intimacy and healthy relationships. So this is a very hard thing. We can learn, we can get better, and it often takes having a healthy partner or caring adults then to help us to get over these deficits that we've acquired as we were growing up, because those strategies just don't work as we get to be adults, at least not if we're going to be happy and be in meaningful relationships.
Right. And one day, and I don't know if this is true, but I was doing this group and I was explaining some of this, And a guy raised his hand and he said, well, I was the only child and I did all of those. And I suppose it's possible. At some point in his life he had done all of them. He had been the hero, he had been the lost child, he had done everything.
Like a one-man band.
I guess so. It happened. One other thing, and a friend of mine mentioned this to me, and I guess it's fair to say I don't like thinking about it because it's not the best thing, but one of the things that happens sometimes with folks who get into recovery in relationships is that they'll find that their partner wanted them to stop getting in trouble and making a mess and losing control, but they really weren't on board for abstinence, and they're really not real sure about like no alcohol, no drugs, and I don't know if this is fair, but sometimes in early recovery, people in that transitional year, if you will, they're not much fun to be. And they're so cautious about everything. They're sort of, it's different for them. And it's really, it's quite sad, but some people in early recovery, they actually have loved ones and friends say to them, you're not much fun anymore. Yeah. And here you are on one side, really struggling hard not to use, not to go back to your old ways, and yet at the same time you're getting this mixed message from families or friends, and mostly friends, who are sort of saying, well, come on, let's party, or let's go out and have a good time, or drinks on me or something. You know what I mean? And they sort of get like, no, I can't. I can't do that. I don't want to do that.
I mean, do you think that's part of this struggle of learning a new role? Yeah, I mean, shedding the old role and learning a new way, because what I've often seen too is because you struggle with this when you first start out, and it's as if people are wanting to bring you back into using again. And one of the problems I think is if everybody's using, everybody's drinking, then it looks normal. If I'm with people who do what I do and we all do the same thing, then that's normal. I can define it that way. And now all of a sudden one of us decides, I'm not doing that anymore. And we have to question it. Oh, is this really normal? Do I have a problem? Should I not be using drugs? Is this not really the right way to live? And I think that's the big challenge. I mean, one, you're struggling with a new role, but two, you're challenging everybody else's ideas of what is okay and what's not, and they might not be ready for that.
And I think on some levels, and a lot of people who want to stop using drugs and alcohol are not really ready for the fact that they need to change an awful lot in their lives. Yeah. And I think it would scare people if they realize just how much they're going to have to change. A lot of times there's this assumption, I'll just stop doing this one drug. Yeah. Like I know a young man who partied with his friends, played sports, jocked, drank, got high, but he got into the wonderful world of opiates. And his life really turned bad. And he got involved with heroin, and he got involved with lots of things. And he was sharing with me that his intention was he was going to go back to his original old friends, the partiers. That the mistake he made was doing the opiates. And granted, that's true. That was his mistake. Yeah. But the reason I was talking to him is that he was coming back in the hospital. Yeah. And what he has found out was that he had almost forfeited the right to go out and get high with his friends.
Oh yeah, and that look when we see young people doing it, it's like, what? Never again? I can't get drunk. I can't get high, and we have to tell them not without great risk.
Yeah, and they said they have memories when they could do it safely. I mean, as far as they're concerned, it was safely. And, I drank all through high school. I got smoked pot every day. Blah blah blah. And they don't really see that it led to where they were. And they also don't understand that once they start using, they're not going to settle for like a beer high. I mean, once you've had an opiate high, it's kind of hard to be happy with a beer high. I mean, it just doesn't work that way.
No, I don't drink anymore. That's garbage.
Yeah, and they go right back to it. So I think a lot of times you'll see this. I know they talk about this a lot. That young people's it's peer relationships that are so important. Yeah. And again, working with people that I know and people who got clean and sober in their 20s, they really don't understand quite how, they're going to have to maybe take another look at their relationships, their friendships, their social activities. what puts you at risk. And before the show started, we started talking a little bit about this. The holidays are coming up, and this is really a dangerous time for some folks. This is a really difficult time for recovering individuals.
Yeah, because there's a lot. I mean, first of all, substance use is really an accepted part of this.
Right.
Right. I mean, you see commercials, advertisements, the idea of holiday cheer. The eggnog, the Yule punch, all those sorts of things. So there's this real encouragement to get out there and drink. So of course, if you're trying to change that, what an awful stress and temptation that can be. And two, if you don't like Christmas, if you don't like your family, if you're not, you or your family or your friends are not the picture from a Courier Nice postcard, right? You just don't look like Christmas. This is not what anybody advertised. Then you really, it's a very difficult time.
Oh, and you'll hear this, and sometimes you'll run into it, and you'll hear somebody say, "Well, I'm just going to treat it like any other day." Well, that's almost nearly impossible. I mean, quite frankly, there's decorations, everybody, people are singing, and it's endless. And so I think we're talking about defense mechanisms. One way is to just try to minimize it.
Yeah, I mean, because you got to cope with this, right?
Right, and I got to get through it. I'm just going to treat it like any other day, and I don't think that's really successful. I don't think that works. And even if you manage to get through, one day without it, thinking about it, I think you've suppressed or repressed so many emotions and feelings that puts you at risk for the following day. I mean, you know what I mean?
Because this is the discomfort, and if you don't plan ahead, especially in early recovery, then you're going to be very vulnerable and very susceptible, because that day will come, and like you're saying, you can't ignore it. It's everywhere. It's absolutely everywhere, and you're just lying to yourself if you say it's just another day.
Oh my God! And it just made me think of something that, well-meaning people sometimes can be really hard. They will say to early recovery, especially young folks, well, listen, just have wine with us at dinner. It's okay if you're with us and you drink. And not realizing that, no, it's not okay. And it's not, they can't just have wine with you at dinner. I almost want to make a public service announcement. If someone says no to you when you offer them booze, don't offer it to them twice.
Yeah, exactly.
I mean,
don't take it as a personal affront.
Don't take it doesn't have to be a criticism. But if somebody says, hey, you want to have a drink, and they go, no, thank you, leave it at that. Because one of the things that we found out with cravings and urges is that some people are able to say no the first time, or are able to say no even 2 times. But it's almost like when you have a child that wants to turn the TV on, the first time you go, no, you can't watch it. And the second time they ask, no, you can't watch it. But the third time you go, okay, turn it on, but only have a little.
I mean, we all get worn down.
We all get worn
down at some point.
So if you're in a social setting and you offer them an alcoholic beverage and they say, no, thank you, I'm driving, or I just don't want one now, please be gracious enough as a host to accept that. And yet you see well-meaning people going the other way, trying to get people to go ahead and have a drink with them.
Because again, that challenges the whole idea of what's normal for a holiday, doesn't it? That we're not all going to sort of get a little buzz on, and that's the way we enjoy Christmas, and we're all going to be okay for it. Not realizing that there's no such thing for somebody who struggles with addiction.
Right. I mentioned this show about alcohol advertising, and one of the ones that they made fun of, they tried to enlighten people about, was the Michelob commercial. And there used to be a Michelob bottle, and inside the bottle was a party. In other words, that's where the party is. And I don't know if you remember, but they used to say Michelob was made for holidays or something. You know what I mean? The idea was, here we have like Johnny Walker or something, this is a special booze, just especially for holidays. And the lady who does the film says, in the beginning, the booze becomes a symbol of the holiday. But for some people, at the end, it becomes a substitute for the holiday. In other words, it is the holiday. It isn't so much like, here's something I'm going to share with my family. It actually, their family is long gone.
Right.
And so you have alcoholics who are living alone in their room having eggnog or something. I mean, it's just sort of almost I won't say pathetic, but it's very sad.
Yeah, and so how to get through this? So we're talking about planning ahead, and realize that it's going to be hard to ignore Christmas, New Year's. These are holidays with a lot of meaning associated with them. It's everywhere. It's all around us. Yet it can be a dangerous time. And if you are struggling with addiction, if you are struggling with being alone, whether it's because of your addiction or depression, or even just say being away from family because this is, you're separated because of career, whatever it might be, how do you plan ahead? What can people do to make sure they have some kind of fellowship, some kind of companionship?
Well, for alcoholics, in our town, we're really lucky to have what they call an alcothon. And it usually runs all day long. It starts at Christmas Eve and goes all the way through Christmas Day. Here in Brattleboro, it's at the Center Congregational Church. And a lot of people will go there as a place for support. They do it both for Thanksgiving, Christmas, and New Year's. And so people from treatment centers sometimes will go down there. People from the halfway houses, some of the people who are in Department of Correction houses will go there, and it's a place to be with other people. I think that one of the nice things for a lot of people is that they get active in helping to set up and be part of it.
Right.
I mean, one of the ways to sort of feel good about the holidays is always to help others, is to be actively involved, to be with other people, to do something that's of a positive community gesture. So I think on some level, that can be very helpful. And I just want to just say something about, for some folks, the holidays are not a happy day for them. Yeah. It really not. It brings back very negative memories. It brings back memories of families that were really dysfunctional, very, very harmful to them. Mm-hmm. And also for a lot of folks who struggle with addiction and alcohol, holidays brings up everything they've lost. Yeah. They're not in touch with their children. They're not in touch with their parents, or maybe their parents are deceased, and they're pretty much alone in their life. And so, for some folks, the holidays can be really, really difficult. Yeah. Yeah. Most of the days, you can make believe everything's okay. You're doing all right. You're by yourself. It's okay. But sometimes the holidays are like right in your face.
Yeah, because sometimes the problem with these, say, less positive coping strategies, defense mechanisms we have, is that it's just building up, and it's going to need to come out at some point. So developing a healthy way to cope, sort of a higher order sort of coping strategy, is much healthier. So like you're saying, go out and be of service. Be with people. Find some way to do something that's healthy, so that you can sort of afterwards say, you know what, I got through that. I overcame that. Because one thing, and this is just my take on this, is one thing I've noticed when you look at sort of people's situations and their expectation of what they want and what they should have, it seems to me that the farther apart those two things are from each other, that the more difficult it is for people to be happy, the more bitter they are, the more depressive they happen to be. And you really don't have too much. There's two choices: either lower your expectations, or you take some kind of action to kind of bring those closer together. So I think what we've been talking about is find some way to make something healthier out of it, right? Join other people, find something positive to do, volunteer at the soup kitchen, go to the alcothon, get involved with something with church or whatever your faith might be.
Right, and have a ritual. Don't be ashamed of it. Don't be embarrassed of it. If there's an opportunity to give a gift, to be with somebody, like you said, if there's a church or something that you once was involved with, don't hesitate to go back and see if it can be helpful to you. And I think on some level it's sort of, I know it's Christmas and that's very Christian, and that's what people want. It's so universal. I think you have to sort of acknowledge it on some level, and you get through it if you have to, or you enjoy it. You find people to be with. I just think I don't think there's any more risk for mental illness. There might be a little more risk for relapse, based on stress, based on anxiety. But I just think I think for a lot of folks, it might be a moment that's just a little bit more difficult day. It's not like every other day. And so I think more than anything else, you want to acknowledge that.
Yeah.
That it's not like every other day. It is a little bit different. And, you know, I need to sort of figure out how to get through this, how to work through this in a sort of healthy way.
Yeah. I mean, the expectation is that people are happy, they're greeting each other on the streets, hey, Merry Christmas, you know, Happy New Year, all that sort of business there. And, you know, there's intimacy to it, right? Strangers are able to say, you know, hello to each other, expect people to be nice to each other. There's the expectation that within our families and our homes that there's going to be, you know, love and warmth there. And a lot of people have not grown up with that, don't have that as a tradition around the holidays. And then with all this expectation, all this attention to it, that really just puts in your face this gap, this gulf between what is the expectation, what's the advertising, what's all the images that you see for it, and what you're really feeling and what you're really experiencing.
Right, and I guess you always hear somebody, they'll say, well, don't forget the spirit of Christmas or something. And sometimes you have no idea what that is. Like, you know, and you'll hear criticism that it's commercialism and everything. But, you know, if you can celebrate this idea, if you know, that it has something to do with sharing, it has something to do with peace on earth, that it has something to do with universal love. If there's a way for you to have some comfort in that, I think that's you know, worth acknowledging. There's one other thing I want to mention. I don't want to make a big deal of it, but the other one is New Year's and New Year's Eve, which is, you know, traditionally big drinking day.
Yeah, anything. That's really what a lot of people think New Year's is all about.
Yeah, and that's unfortunate. But a nice thing that's been happening over the last decade or so is something called First Night. And that's an attempt to change that whole dynamic. And I think they've been pretty successful with it, where people now expect, like, you know, New Year's Eve is not necessarily all about drinking. It's not about, like, getting drunk. You can actually have healthy, sober activities with young people and really change the way people think about it. The idea that you want to start off the new year drunk, I don't think that's a great idea.
Or end the year drunk and start it hungover.
Yeah, right? Either way, I wouldn't recommend it. And I'm glad that we're sort of getting away from it. At least I hope we're getting away from it. I know there'll still be, you know, people blowing, you know, champagne and everything, and those who can get away with it, go ahead, you know, have fun. But I think for other people and for some families, I think you might want to see if you can change the focus of New Year's a little bit.
Because it's always bothered me when you look at, for example, colleges or towns maybe that have a reputation for being party places, whether it's the University of Vermont or it's New Orleans. It's like about drinking. It's about drugs. And at some point, celebrating, partying, being happy became to mean drinking and drugging. And I think that's really a shame, because we can have Christmas and celebrate without being drunk and being high. And New Year's, I mean, traditionally, right, it's a way to sort of look back on the year and the accomplishments with warmth or with regret, and to look forward to the new year and changing expectations or changes in yourself, making positive changes. I mean, the whole idea of January, was the Roman god Janus with two faces looking forwards and backwards. So it's not necessary that drinking has to be a part of your New Year's.
And I'd like to close on this positive note, basically to say that, you know, when I worked in the hospital, I used to have people come in around Christmas and New Year's because they really did not want to mess up again. They really did want to make a change in their life. And I know everybody makes fun of New Year's resolutions, but it is a good idea. Make a commitment, have a healthy and sober, enjoy yourself, enjoy your life, and please, you know, don't give up on recovery, don't give up on yourself. And, Merry Christmas and Happy New Year to everyone. Thank you and good night.
Let's have some hope. Thank you. Ready? 1, 2, 3.